Hello and welcome to episode number 13 of the Long Island Daily Roast. I'm your host, Sally Oda,
And I'm your host, Gary Lombardi.
and today we have a very special guest by the name Marc Berlin. Please introduce yourself.
I am Marc Berlin. I am originally from Valley Stream, New York. I am living in Cedarhurst, and I am a healthcare consultant and patient care advocate.
Amazing. Now, tell our audience a little bit, because I read your story and I was humbled. Um, tell them a little bit about growing up, kind of some of the struggles that you had to face.
Well, I was diagnosed early on with cerebral palsy, like 6 months to a year old. And because of that, it affected my right side, my right arm and my right leg. Because of that, I had a lot of surgeries early on with tendon release came first, and then in the leg, and then the arm, and then had some other surgeries related to osteotomies and leg lengthenings when I got older in high school and college.
So how did that, as far as I could imagine it affected your workflow, as far as getting work done and stuff.
Starting young, it affected school, especially grammar school. I wasn't as fast as everyone. People noticed the limp, and it was difficult doing sports, riding bicycle, catching. Especially, and I didn't realize it at the time, but my father had me use a right-handed glove. But it was very difficult to do that. But later on, when I was in grad school, someone taught me how to throw a ball and catch with my left hand. And that was an amazing story because I was a big supporter and fond of Jim Abbott, who was a one-handed pitcher, started at Michigan, and then pitched a no-hitter for my favorite team, the New York Yankees.
I'm a Yankee fan, too. I think we're going to have a good year.
I think it'll be a better year.
Yeah. So now walk us through, as far as, what exactly do you do for people today?
Well, today I am started a service right before COVID as a patient advocate, and which my focus is helping older adults, seniors, and people with disabilities, helping them navigate and guide themselves through the health system, but also helping them age in place and remain safe at home. Now, it could be helping them with a medical appointment to their doctor, finding the right specialist, helping them when they get an insurance claim that was denied and they think they have to pay it, calling the insurance and getting it reversed, and helping them with a word or a medical supply or even getting a home health aid, doing what we call in business care coordination.
So you cover everything from they come to you and you cover the whole ride.
Not everything. My focus, different advocates have different focus. My focus is on those wanting to remain safe at home. There are other advocates that focus on finding a place like an assisted living facility.
Okay.
I will help also when they are in the hospital and they need to find a subacute or rehab facility.
Okay. Yeah, I was reading through some of your testimonials. Your clients love you. That's for sure.
I actually started it my reason why I got into it is because my mother was diagnosed with a brain tumor in 2015, and she passed away April 4th is 5 years. And my father passed away 7 months later. So in the Jewish religion, you say Kaddish for a year. Mine was extended, so it was 18 months. After that, I was looking for something to do, and I found a place called Parker Jewish Institute had a program, the Willing Hearts Helpful Hands program, which is for people who got diagnosed with early onset dementia, and it's respite for the caregiver. So I did that for a couple of clients during that time, and then when I was also in a support group at the Jewish Community Center of Oceanside, I found this wonderful program. The social worker found this program through an organization called Pulse, which is the Center for Patient Safety, Education, and Advocacy. And that really got to me. And I felt like I could relate and could have passion about helping others, especially when you get diagnosed the way my mother did and all these surgeries that I went through growing up.
It's amazing to me that you've been through the works, and to bounce back and to help this people going through the same issues is amazing.
Yes, especially when it happens to a parent or when you experience it yourself going through surgeries. I've also worked on the side In addition to my work in provider relations and HMOs, I worked for several group homes for people with developmental disabilities over the years on treatment goals and activities of daily living.
What are some of the biggest challenges you face on a day-to-day basis now?
Well, until recently, it was getting out of the house because everything was closed down. Now I'm beginning to get out more and promote my business a lot more. I'm able to meet people in person. Really a lot of marketing and networking.
Networking, yep.
Yeah, I just started the service right before COVID, so it's still in the early stages, but I've had some clients and helped them along the way. And I'm also joined the Oceanside Chamber of Commerce. I'm now on the board of Alzheimer's Disease Resource Center, ADRC for short. And I'm also a volunteer with the Pulse Center for Patient Safety Education through Advocacy.
That's amazing.
Yep.
That's amazing.
So Marc, this business that you refer to, and is this something that is it all nonprofit, or how does that work?
The business that I'm trying to start is I'm what is known as an independent patient advocate. So hospitals and nursing homes may have their own advocates. So
okay.
Work independently. Families will call me up because they have an issue with a loved one, whether it's a parent, an aunt and uncle, or an adult male or female who has special needs.
So walk us through, like, how did you get your first clients? How did you market yourself to them?
It was actually word of mouth. I was in a networking group, and someone in the group needed help with one of their parents. The medication wasn't approved and the doctor prescribed medication. So I had to call up their insurance carrier and asked for a medical necessity of need. Got that and sent it to the woman to have the doctor fill it out so she can get the prescription filled.
And then from there,
I got another call. Someone whose husband was in the hospital and he was going to be discharged. He didn't know where to send them to.
And so how does this business work exactly? Is it like a some sort of, like, you have to go to school for this, or?
Well, my background started in human resources.
Okay.
I have my BSBA degree in human resources from the George Washington University, from the American University. And then I have my master's in healthcare administration from the George Washington University. In undergrad, I focused in business and in human resources, reasonable accommodations for people with disabilities. I did an internship at the Epilepsy Foundation and studied human resources and the ADA, which came out in 1990, and adaptive equipment to be used, not only at work, but also getting to work. Reasonable accommodations in the workplace. And once I graduated there, I had some more surgery, actually, and then I thought about going back to graduate school. But I knew I didn't want to go to dentistry, and I didn't want to be a lawyer, and then healthcare was an option, and I explored that, and I decided to get my master's at George Washington University.
Incredible.
And then I did a administrative residency at the Veterans Affairs Hospital in Richmond, Virginia for a year.
So, Marc, how old are you, if you don't mind me asking?
I am 53.
53. And you did it. So you did a lot of time in school.
Yeah.
How many years in total?
Let's see, 4 years undergrad, 2.5 years graduate school. I also took a course in 2009 for office administration, medical billing, as well as courses related to advocacy through an organization called the Alliance for Professional Health Advocates. And I'm studying to take certification next week.
That's great.
So yeah, I'm curious, Marc. How much? So if somebody needs to possibly go into a nursing home, a family member, and whatever that may be, what action they call you, and do you directly do all that legwork to get them started and placed, or do you have other people that you give certain portions of the work too? How does that work, the business actually?
Right. Every case is different. So when I get a call, I will do an intake, and then I'll
Intake.
read the intake, and then I'll do an assessment to see, what conditions of the client, medications, the doctors, where he's at, or she's at, or where she's at, where the person's at, and find out what they need, where they need to go, because patient that's on the South Shore may not want to go to a rehab that's on the North Shore. Person that's close to the Queens-Nassau border may not want to go to someplace in the Nassau-Suffolk area.
So now you determine where they need to go,
Right.
and then what is that process? Then do you make the
research and find places that meets their criteria?
and do you actually do the research?
I will research, yes.
Yes. Okay.
Yeah, that's great. I mean, I'm glad that
now you'll do the.
I'm glad that you're participating in the networking things because, this is something a lot of people need.
Yeah.
This is the first, listen, I'm not very knowledgeable when it comes to the medical field as far as like roles and certain things like that. But I always assumed how does a 65-year-old woman know, which insurance company to call? They don't know this stuff. Either they don't know it or they can't do it. You know what I mean? It's not something that they're good at on the phone about.
Correct. The other thing I should specify, I can direct people to get insurance, but I don't put them on insurance plans. That's not one of my, but I have a network that I align myself with people to help, to assist in the process.
So there are actually brokers,
advocates, and other people in the healthcare world. It takes a village.
Yeah,
it takes a community to assist people.
So there's actually brokers too, right, Marc? That
deal with Medicare and other Medicare Advantage plans and Medicaid. I can help assist people to get on to community Medicaid, so they can afford home health aid if need be.
Okay. All right. Wonderful. Yeah.
Area. And I know when having worked with HMOs for nearly 15 years, I know what it's like to get a bill when it gets denied and they're not paid.
Yeah, I can imagine.
So so now that happens, okay, so they may have some coverage. Medicare really covers pretty much most of it, right?
Most of it, yeah, but sometimes certain medication may not be covered in the formulary, or sometimes they might switch plans. And during the switchover, A or treatment A was not covered.
So they got billed. They could get billed for tens of thousands of dollars. Really, people don't realize that medications and procedures can cost that much. Okay. Correct. So when
no insurance at all.
Yeah. So now that's really in need of help. So have you had that people come to you with those situations?
The only one I mentioned about with the certain prescription that wasn't covered, but I used to work for 3 Medicaid, Medicare HMOs, Health Plus, Health First, and HIP Health Plan, which is now Emblem Health, all in the provider relations ancillary field. So I've dealt with individual providers trying to get them to become in-network, and add it so that patients can see the doctor and not be billed, and the doctors can be in-network and and grow the insurance company, because they were small at the time. Health Plus was particularly.
So what are your plans as far as like like where do you see this business in the next couple of years?
Well, the next few years, I'm going to continue to market. I'm going to continue to network, look for new clients, look for other alignments, and assist people. Look for those that need that assistance when they don't realize they need the assistance. I also plan on doing in the spring, which I was going to say in a few weeks, but now it's here, presentations at libraries on senior safety at home and aging in place. I'm doing one in June at the Freeport Library.
That's great. We'll have that information in the box down below for anybody who's watching right now.
I had a client who was a vet, served in the country and needed help getting to a doctor's appointment. Now, it wasn't just me taking him there. He was also hard of hearing. He couldn't get there. And remember, we're dealing with COVID. So not only could he not hear, we had masks on.
Yeah.
So he couldn't hear what the nurses and the doctors said, and the doctors couldn't hear him. So I was the go-between for those appointments. It was for a wound care appointment. I also took him to a cardiologist. So every appointment, I had to make sure that he understood what was going on, what was being said, and relate that to the family.
That's amazing. Yeah, I feel like, especially with the vets, I hear stories all the time where it's like they don't get the proper, I guess you could say, advocacy that they deserve.
For the proper treatment and services.
Yeah, exactly.
Especially after serving our country for so long.
Has that been changing, Marc, though, in the last several years?
What's that?
The service, the healthcare providers taking care of our vets and treating them differently. Has that changed in the last couple of years where it's gotten better?
I think people are noticing more that they need to work on this. They need to work on the mental health issues.
Yeah, that's a big one.
Isolation has been a big problem especially during COVID. Fortunately, who knew about Zoom before COVID? But I also freelance for a mental health clinic based in Brooklyn, and I've seen the cases increase during that time. And it's so important, not just for older adults, but kids. They're used to being in school. Now they're isolated at home. They were isolated at home for 2 years.
Yeah, it's even those kids that were just getting into their senior year of high school that didn't get to experience that graduating.
Right.
That's rough on kids, especially at that age. Like it took a hit on a lot of people.
Definitely.
But I think at the same time, I think it opened up a lot of eyes in the sense where like for instance, do you think that this was something you were going to be able to accomplish if COVID didn't happen? Is it something that would have crossed your mind to follow with?
With the advocacy?
Mm-hmm.
I was going to do it either way. I started it right before COVID, like in the fall of 2019.
Oh, you started it right before.
I started joining the association, and I took a training course through Pulse, Family-Centered Patient Advocacy. I think COVID enabled me to take more courses and focus more on the plan and what I wanted to concentrate on.
Yeah, like for me, it was kind of like I worked a union job leading up to COVID, and then them laying me off for a couple months. Whatever. Everybody was getting unemployment, and we know how that's going. But, I was like, you know what? I think it opened up. I'm definitely not the only person it happened to, but it opened up people's eyes that, there's a bigger world out there. There's business, maybe I should just try it. I got the time anyway. So I think a lot of people either took that time, they were taking the government's money and did nothing with their time. But I'm very happy to see that, you took the time and really, really did it. It's admirable.
Two things during COVID, I took advocacy courses. I took training through Pulse called the Take Charge campaign, which is 5 steps to safer healthcare. And I've incorporated that in one of my presentations on taking charge, being one's own advocate, which are things that people don't think about. One of the steps is understanding and completing advanced directives, having healthcare proxies completed, especially if you're on a ventilator, who's going to speak for you when you can't speak for yourself? Right. The other thing is keeping a list of your medications and your medical history, your doctors. Third is preparing for your doctor visits, asking questions to make the most of your time and make sure that all your questions are answered before the end of the visit. Fourth, people don't think about it as much, but with COVID it did, washing your hands. Asking caregivers, whether it's the nurse, the nurse assistant, the medical assistant, the doctor, wash their hands before they examine you. And using an advocate, whether it's a family or a professional advocate, have someone be there for you.
Yeah. So tell me about just a quick question, side question. What do you think about courses?
Think about?
Courses.
Oh, courses in
general, taking courses for trades, because there's a lot of mixed ideas on that.
There is, but I think during COVID it was easier because there wasn't a lot to do. And I think what I'm going to be taking next week, the board certification, enables people to realize that you have that credential. Yes, I have a bachelor's. Yes, I have a master's. Yes, I have almost 20 years of work experience. But to be a board certified patient advocate shows people that extra step.
And now, is this your full time thing?
Not it will be in the next, hopefully the next 3 to 5 years.
Okay, amazing.
And one other thing about COVID, on the personal side, I trained with a trainer. I started working out with a trainer, and I've done things with a trainer, having cerebral palsy, I never thought I could do. I think I could do using a hex bar, doing jumps, cable rows. It's just unbelievable what one can accomplish.
Yeah, you put your mind on everything, and mind over matter is big.
Definitely.
All right, so Marc, tell us a little bit about the places you've worked.
Okay, well, after graduate school, I worked at the VA for a year and a half. That was a requirement to work as an administrative resident. Did that in Richmond, Virginia. I came back to New York, and I worked in human resources at Parker Jewish Institute for Healthcare and Rehabilitation and at Winthrop Hospital. Then I made the change to credentialing for the Institute for Urban Family Health. And then from there, I went from credentialing to contracting, provider relations, and ancillary services for several, as I mentioned before, several Medicaid, Medicare HMOs. And then I worked for a medical alert company called LifeWatch. At the same time, I was working for a diabetic company, all services and products for seniors. And then what happened, the economy turned, and so those jobs ended. And then I've been working as a consultant for outpatient mental health clinic in Brooklyn, doing that. And then the Advocacy came along.
It kind of all tied together, right?
Yes, I think it really does. I just thought it was something on TV. I didn't think it was a business.
So tell us a little bit about the events that you have coming up.
I have a presentation at the Freeport Library in June. I'm working on one for the North America Library. What else do I have coming up? I'm also working on, the next 2 weeks I'm working on studying for the board certification and doing more networking, and also part of the Senior Umbrella Network and the National Aging in Place Council.
Yeah, I'm actually a part of the Glen Cove Chamber of Commerce, so I definitely want to see you in the future at one of these events.
Now that the weather's better,
yeah, everyone's going to be out.
No, actually, since beginning of the year, I joined the Oceanside Chamber of Commerce because I want to work with South Nassau Hospital in Oceanside, as well as be involved with the JCC of Oceanside. And this month, I'm on the board of Alzheimer's Disease Resource Center. I'm looking forward to participating in that. I'm a recording secretary, and I continue to volunteer with the Take Charge campaign and Pulse.
That's amazing. So Marc, if there was one thing you could say to a future client who's maybe watching this video right now, what would you say?
Well, if it's the child of a senior, I would say make sure you have systems in place. Right? Make sure you are know your mother, father, aunt, uncle's medications that they're on. Know which doctors they're on. Make sure that the parent knows that they have the numbers to call in case of an emergency. Make sure they have their advanced directives completed. For if it's a parent of an adult child with special needs, allowing them to be independent, but also make sure they reach out for assistance when need be.
And Marc, do you have a consultation fee?
No, for the first session, there's no consultation.
You heard it here first, guys. Marc has a free consultation. Okay, yes. So if you're thinking about getting an advocate, call Marc. Marc, one last thing before we get into closing this podcast. If there's one thing you could say to somebody who has an idea, and you know what, and I really want you to touch on this because the things that you've been through and the things that you've seen, all right, you went against all odds. So if there's one thing you could say to an entrepreneur getting started, what would it be?
And I'm still doing it now. I'm still in the early stages, but take your time. I was in a rush. I think when the economy turned in 2008, 2009, I was in a rush to get a job and be successful and maintain the level I had when I was working full time. I think I learned from that experience to now to take my time. Don't don't be afraid to do the hard work and do it right. Take the time to do it right, and make sure you network with the right people and get to know people, and work on how you as an individual can assist others in helping them succeed, helping them overcome.
Amazing. So, Marc, where can our audience reach you?
There's two ways. I have a website, onthemarcadvocate.com. My email address is marc@onthemarcadvocate.com. There's a form you can get in touch with me on the website. As well, I'm also on Facebook and Instagram at MSBadvocate21.
Great. So we'll have all those links linked down below. I'm just going to switch over to Marc's website. This is what it's going to look like when you get here. You just get to the home screen. It'll look like this. And then the forms would be in the contact section here.
Correct.
So you could put your name, phone number, email, and a comment. Like Marc said, he's free to speak to the first session. It doesn't hurt to call. I want to thank Marc, first off, for coming on the show.
The Greater National Advocates. It's another alliance that I'm a part of that lists advocates that you can reach out to. And they've been very helpful.
Oh, Marc, where can they find out the event details for the presentations?
Oh, I will put that out on my Facebook page.
Okay.
When I get confirmation. But I have a definite date for June 2nd at the Freeport Library.
Okay.
I believe that's at 1:00.
And that's going to be on your Facebook page.
Yes.
Great. So we're gonna have those links up. Check out his Facebook page for that presentation. All his socials will be linked down below. I want to take this moment out to thank Marc for coming on the show and speaking with us. We really appreciated it, Marc. Thank you.
Marc, thank you so much, Marc. Really great.
Thank you all for watching episode 13. I'm your host, Sal Liotta.
And I'm your host, Gary Lombardi.
And you all have a wonderful day. Thank you.
Take care.